Harold Shipman was born on January 14, 1946 in the United Kingdom to parents Vera Shipman and Harold Shipman. There weren't any early signs of an issue, although his mother instilled a superior attitude by dressing him in ties and dictating his friends. His mother was diagnosed with cancer when he was 15, and he was her primary caregiver and was in control of her drug administration. He became interested in medicine when he watched his mother receive morphine injections while dying of lung cancer. His mother died in 1963 when Shipman was only 17 years old. When his mother died, the loss of power is thought to lead him to being a doctor to regain his power over people. He received a medical degree from Leeds University in 1970 and became a general practitioner. He became addicted to drugs and was forced out of practice and into drug rehabilitation, but he returned to medicine 2 years later. Were from 1975 to 1998. His first murder was a 4-year-old girl who was ill, and her mother told Shipman to be kind to her. Shipman believed it was a plea to kill her, and he would inject his patients with lethal doses of morphine and watch as they lost consciousness before dying. It would usually occur in the patients' homes, and they were fully clothed and sitting upright. He is accused of about 280 murders, and they were mostly elderly women. They were older and lower middle-class people. He also sent the death certificates, so there weren't any autopsies. He was captured in February 1999 after one of his victims, Kathleen Grundy, left him everything in her will. Her daughter went to the police, and her mother's body was exhumed and morphine was found in her body. After being arrested, when interviewed by the police on one occasion, the police described him as controlling, and he even broke out into tears of frustration, not guilt or remorse. He was charged with the murders of 15 women by lethal injections of diamorphine and forgery. He was defended by Nicola Davies and pleaded not guilty. He was found guilty and was sentenced to life in prison, but hanged himself 4 years later on January 13, 2004. Harold Shipman refused to see any psychologist. The only one he saw described him as a control freak and thought that he was better than everyone else. It is believed that he had a personality disorder, and he was narcissistic and was addicted to drugs and had long-term mildly severe depression. Many psychiatrists believed him to be sadistic, but Shipman didn't really humiliate any of his victims and only killed them, and they had a rather peaceful death. Additionally, they believed him to be necrophilic, but there's not much evidence that Shipman had the desire to have sex with the corpse. Rather, he most likely had the pleasure in being in the presence of death. He went to rehab for his addiction, but did not go to any therapies. I believe nurture had a larger impact on his life because he received a superiority complex from his mother and was clearly influenced by his childhood. He was in control of his mother's health, and his childhood trauma and narcissism led him to commit these crimes. I do believe that these crimes could have been prevented. Harold Shipman only went to rehab and didn't go through any therapy or psychological treatments after his addiction and childhood trauma.